There is a brand new report out this morning from CIHI, the Canadian Institute for Health Information, and it suggests there's been a shift in how children in Canada are accessing mental health treatment. Marianne's been going through the report, has the details. Good morning.
Good morning, Heather. Yes, this report looked at kids and youth aged 5 to 24 who sought treatment for their mental health disorders during a very specific time period, pre-pandemic from 2018-2019, and the latest data post-pandemic from 2023 to 2024. And as you heard Heather just mention, it shows that the way kids are accessing their supports and care and where they're getting them may be changing. You're looking at some numbers here and some arrows pointing down. That refers to emergency department visits as well as hospitalizations. It found that fewer children and youth are seeking and getting care from emergency departments for their mental health disorders. You see that number down 31% between that time frame I mentioned, 2018 to 2024. Hospitalizations also down 23% when it comes to hospital stays in that same period. Now, looking at other numbers here, some numbers are actually going up, and that comes when it, that's when it comes to visits. Doctor visits for mental health disorders. Children and youth visiting physicians for mental health disorders up 8% from that time frame. And for medications, the rate of children given mood and anxiety medications for their mental health went up 18%. Same period of time, 13% increase for kids and youth given antipsychotics. So a lot of numbers there, but what's important to note here is where the children and youth are accessing the care for their mental health disorders. It is changing, though this report didn't necessarily say whether the mental health of this age group is actually getting better. They did say it does say a lot about where they're getting support, more community-based care.
Marianne, thank you very much. Let's take those main messages and findings in this brand new CIHI report and bring you some analysis. Dr. Samir Gupta is back with us this morning, respirologist and associate professor at the University of Toronto and in the School of Medicine there. Dr. Gupta, good to see you again.
You too, Heather.
Let me just begin by asking you about this. The overall takeaway maybe from Marianne's reporting on all of this in the report just out is the incidence, the prevalence of mental health conditions for Canada's young people, children and young people. As you look at the report, is it getting better or worse as you see it?
Yeah, so this report, Heather, is all about, as you heard, access and where folks are accessing services. We know from other data, and we've talked about, and people know because it's sort of in the news, in terms of how much the burden of mental health disorders has increased, particularly during the pandemic, with the upheaval of the pandemic and the sort of changes in our social structures. We have seen that increase in particularly mood and anxiety disorders. And by the time you hit the age of 25, so this report is about young people, by the time you're 25 in this country, 1 in 5 people has a diagnosis of a mental health disorder, a formal diagnosis. So this is very common. So that's sort of, the backdrop. The backdrop is there's more and more burden. What I think is good, and I think this is a good news story largely, is that despite that in the community, we're seeing more and more burden and prevalence. We're not seeing that pressure on our urgent care services. We're actually seeing the opposite. We're seeing a drop in access to emergency care and hospital care. So that is a good thing.
That's a good. Let's break that down in a little bit of detail. So the prevalence, the concern about young Canadians' mental health, that is unchanged. But what has changed is this shift. And what we're looking at here is this graph, Dr. Gupta, showing emergency department visits. It's down 30% in the years that Marianne was telling us about, 2018 and 2023. So you see that as, and one would, presumably, a plus, a good thing.
That's right. And we're seeing reciprocal things. We're seeing this drop in urgent care, emergency care hospitalizations, but about this 10% increase in community access. And that's mostly family doctors, pediatricians, and psychiatrists. So CIHI is able to access data around billing, physician billing. And so it may be that if we put the story together, it may be that people are able to access those community services more. They're getting the care they need. That correlates to the other data we have around increased medication. So about a 15-20% increase in medications used for psychiatric disorders. And so it could be that they have the care, they have the medicines they need, and therefore they're less likely to be in crisis and less likely to need that urgent care system. So if we put it all together and wrap it up in a bow, that might be how we see it. I think generally we can see it as a positive. I will say that there are things we can't capture through CIHI data, community services. So we can capture billing, but we can't capture services that physicians aren't offering. And for mental health, we have psychologists, we have counselors, social workers, we have virtual stuff, we have kids helpline, we have online things like Anonymous Friend, where you have social media access to peer counseling. So all of these things have increased during the pandemic. Kudos to federal and provincial governments. They really invested in these community-based services. So it could be that people are accessing these things more and more. And as a result of that, less likely to be in crisis and less likely to need the urgent care system. So I think all of these things are more robust in the last several years.
So being able to access in the community, as this report seems to indicate, means, more appropriate care, maybe more timely care, better outcomes overall, Dr. Gupta?
That's what we believe. And again, this doesn't tell us that, it's the reason we see these trends, but that may be how all of this comes together. The thing I will say is that there remain disparities, Heather, and this is true in any chronic disease. It's true despite our universal healthcare system. When they look at, in CIHI data, you look at postal codes to determine income levels. They look at neighborhoods with postal codes associated with lower incomes. You don't see the same degree of improvement. You see higher access relative to higher income neighborhoods. You see higher access rates to urgent care services, higher hospitalization, and you see lower access rates to community-based services. So there are areas still where, like in other chronic diseases, people have less access to primary care, and it may be because they can't access primary care that they end up needing those crisis services more. So still some work to do to help with those disparities and folks with lower income who can't access in the same way.
And when you looked at those disparities, because I know they did catch your eye, some of the other areas where there were differences were in terms of age and sex in the survey group.
Sure. For sure. And as we've seen across data sets, there's higher prevalence in females than males, and you see much more access to urgent care services among females. And there are age groups, in that teen age group and young adult age group where there's also higher access. And those are very challenging age groups, particularly with what happened with the pandemic and loss of social support and social networks, where we did see a very dramatic change in burden. And that's reflected in these data as well, Heather.
Dr. Gupta, thank you. It's good to see you again, and I appreciate the context you've given to all of this. See you next time. Dr. Samir Gupta in Toronto.